Welcome everybody to our video resources about Community Pharmacy Contraception Service. I'm Mike Jones. I'm the Services Implementation Lead for Nottinghamshire LPC.
And I'm Liam Stapleton. I support the LPC with training initiatives.
So we wanted to produce a set of videos that are available to help pharmacists and owners set up this service and run this service in the future. So this is the initial video, and in the next few minutes, Liam and I will take you through the top line details of the new contraceptive service. This is the first of 5 videos that will be available on our website and on LinkedIn.
So the service has been on pilot for Tier 1 for over a year, started in April 2022. Earlier this year, it started the Tier 2 pilot as well. Feedback's been very positive, especially from women who really struggled to get an appointment with their GP to obtain repeat prescriptions for the oral contraceptive. Since April 2023, contractors have been able to sign up to the Tier 1 service, and so far in Nottingham, we have 35 pharmacies signed up to provide the service.
So as Liam says, this is all about the ongoing supply of oral contraceptives. This fits with the NHS long-term plan to have services provided by the relevant professional and supports the local authority plans for sexual health services. In terms of the patient journey, the service can be initiated with the patient in your pharmacy, or secondly, the patient can actually be referred to a pharmacy from a GP or a sexual health clinic.
So what are the benefits of this service? The overall aim of the Pharmacy Contraception Service is to offer greater choice where people can access contraception services and create additional capacity in primary care and sexual health clinics or their equivalent to support meeting the demand for more complex assessments. Patients will benefit from access to healthcare professionals swiftly. And in the pilot, feedback from patients was that they found it really positive that they don't have to wait to see a GP, and they could have swifter access to their repeat medication via the PGD. For the GP, it frees up appointments in the surgery for patients that need to be seen by the GP or a nurse. It also allows the GPs to develop a closer working relationship between primary care professionals. So for pharmacy contractors, the service will support the important role of community pharmacy teams in terms of helping address health inequalities locally and providing wider healthcare access in their communities and signposting services to users in the local sexual health service in line with NICE guidelines. It provides a revenue stream for the pharmacy. So within the pharmacy, the pricing structure is that there is a setup fee of £900 paid in instalments. So £400 for signing up for the service, and then £250 that can be claimed after the first 5 consultations, and £250 claimed after a further 5 consultations. Each consultation, the pharmacy will be paid £18. They'll also be reimbursed for the oral contraceptive they've supplied at the current drug tariff price. So essentially the same reimbursement that they'd get for a prescription. The supplies can be made with existing patients as well as referral from a GP or sexual health clinic. So it's an extra service that we can provide to the patients we've started to create relationships with. And it'll mean that they come straight back to your pharmacy in the future for their repeat supplies. For other members of the pharmacy team, not just the pharmacist, technicians can be involved in this service once they've had relevant training. So they can fulfill parts of the service in terms of taking blood pressure, calculating BMI, and providing information. So what are the next steps, Mike?
So there are a few. So first of all, we'd recommend that you check out the service specification on the PSNC website. Start the training you need to do and any training that other team members need to do, and get yourself self-certified to provide the service. I think the third point is what conversations you're already having or going to have when with the GP surgeries and your local sexual health clinics, so that you can talk to them about the way your pharmacy can offer this service. I think fourthly, identify those patients you already provide a dispensing service for, and start to have conversations with them about their ongoing supply of contraception, and introduce that service to them. Remember too, that this service does require to use a blood pressure monitor, and that kit will need to be available in your pharmacy before you offer this service.
Okay, so we hope you've seen that this service could be a valuable service for your local community and your pharmacy. We'll be providing more videos. There'll be 2 that focus on setting up the service, getting your pharmacy ready, and getting your team ready. Then there'll be 2 that will focus on running the service effectively. These will be kept focused, and will supplement material from other resources such as Community Pharmacy England. Look out for more details on the LPC website or social media sites as well.